and I am joined this afternoon by Commissioner Jeanne Lambrew, Commissioner of Maine's Department of Health and Human Services. Commissioner Lambrew and I are pleased to join you this afternoon after a couple of weeks to talk about where we are with respect to COVID-19 for the entire state of Maine for today, July 28th, 2021. I'll begin by talking a little bit about where we are from a public health perspective, talking about some recent guidance from the US CDC, and then turning it over to Commissioner Lambrew for a discussion of where we stand on some issues with schools. And to begin, I have some sad news. Just in the last 24 hours, Maine CDC has received the report of another individual who has passed away with COVID-19. He was a man in his 80s from Penobscot County, and his passing marks the 899th death associated with COVID-19 in Maine. We'd like to take a moment to offer his entire family, set of friends, and community our deepest condolences during this time of grief. Right now across the state, there are 70,141 confirmed cases of COVID-19. That represents an increase of 65 cases since yesterday. Cumulatively, we've had 2,135 people be hospitalized. And right now, there are 41 people in the hospital with COVID-19. 16 of them are in the intensive care unit, and 9 of them are on a ventilator. Our positivity rate in Maine now stands at 1.5%, and our testing volume now stands at 221 PCR tests that are being conducted for every 100,000 people in the state. Before I turn things over to Commissioner Lambrew, I'd like to take a moment to discuss yesterday's recommendations from the US CDC, which were updated to discuss when and where individuals should wear face coverings, even if they are fully vaccinated. Well, let's start by asking and talking about what has shifted. Having reviewed these guidance, we suggest that Maine people follow these recently updated US CDC recommendations on face coverings. I want to focus on 2 of those recommendations today. The first one is that people wear face coverings when in indoor public settings in areas with substantial or high levels of community transmission, regardless of their vaccination status. Right now, that would apply to vaccinated individuals in York and Piscataquis counties. The second recommendation is that all teachers, staff, students, and visitors in K-12 schools wear face coverings, regardless of their vaccination status or their county of residence. Now, what precipitated this shift in recommendation from the US CDC? In a word, the Delta variant. The Delta variant is different from other strains of the virus. Based on what we know today, the Delta variant is more wily and more formidable. It's roughly twice as contagious as other strains of the COVID-19 virus. And it has become far more prominent in Maine, accounting for at least 47% of new cases, and likely even more than that. On top of all this, in rare situations, even people who are fully vaccinated can transmit COVID-19 to other people. So why did the US CDC shift its recommendations? Well, it's that last point that explains this update. Specifically, the risk that you could unknowingly, inadvertently spread the virus to someone, even though you yourself are fully vaccinated. That someone could be a child who's too young to be eligible for a vaccine, or an immunocompromised person for whom the vaccine may not be fully effective. This is a rare phenomenon, and the risk of this happening is thankfully low, but it is not zero. By masking up in indoor public settings, in places where there's a lot of virus, even though you're vaccinated, you reduce that risk of accidentally, inadvertently transmitting the virus to vulnerable people around you, a risk that, because of the Delta variant, we fear may be growing. Now let's talk about what this means for you, and specifically what has changed and what hasn't changed. Let's start with what has not changed. The most important thing that has not changed is the role of vaccines in getting us out of this pandemic. Simply put, vaccines remain the best tool we have to keep ourselves safe. They continue to work, and they continue to work well. The 850,000 fully vaccinated Mainers have a very strong degree of protection against the variants, including Delta. Those 850,000 Mainers are overwhelmingly avoiding severe illness, hospitalizations, and deaths. In fact, the vaccines can help prevent the Delta variant from spreading even further. Most of the spread that's happening around the country is among unvaccinated individuals and in areas of low vaccination rates. Thankfully, Maine overall has quite robust vaccination rates. But the one thing that hasn't changed throughout all of this in the last few days is our need to have more people get vaccinated for us to be able to stay ahead of any changes with the virus. The bottom line is simple. Vaccines are still protecting people against severe illness, but we're seeing an increase in the rate of breakthrough cases nationwide. And one of those breakthrough cases could affect somebody who hasn't been vaccinated. And that's why the US CDC recommended this change in guidance that we too are recommending. Now, what does this mean for you? What has changed? Well, again, to go back to what hasn't changed, for the bulk of Maine people, this shift doesn't change anything. If you want to get outside and enjoy the Maine summer, that hasn't changed. If you're not vaccinated, this hasn't changed because we continue to recommend that if you're not vaccinated, first of all, you go get vaccinated, and second of all, you wear a mask in any and all indoor public settings, regardless of where you live and what the spread of the virus looks like. On top of that, if you live in 14 of Maine's 16 counties, the recommendation for whether to wear a mask in indoor public settings has not changed, though it could in the future. But for right now, this recommendation applies to only 2 of Maine's counties, York and Piscataquis. So what has changed is the recommendation for the 8,000 fully vaccinated individuals in Piscataquis County and the 122,000 fully vaccinated individuals in York County. If you are one of those 130,000 people watching today, the best thing that you can do to continue keeping people safe is to throw on a mask when you are in an indoor public setting. Now, let me close by acknowledging a couple of things. The first is that this change in recommendations from the US CDC is, for many of us, many of you, unexpected. A year ago, we weren't even talking about variants. But now it seems that every single conversation we have is some form of noun, verb, and variant. This is a reminder that we're still in the pandemic. But it's also a reminder that this is science, and this is what science does. Something new comes on the horizon, scientists study it, and our recommendations to keep you safe evolve as a result. That's what good science does, and that's what's happening here. The other thing that I think we should acknowledge is that Maine people throughout the pandemic, when faced with the choice of whether to do what's right or what's best for all of us, have consistently made that right choice. And that's why I'm hopeful that even vaccinated folks in Maine will continue making the right choice by wearing a mask if they are in those counties of substantial or higher transmission, when they go out into a public indoor setting. Again, Maine people have always and consistently made the choice to do what's best for all of us, and we think that they will continue to do so here. And finally, the focus in the last 24 hours has been on masks, but we can't detach that focus from vaccines. Things like masks and vaccines are like so many other things in our lives that provide us safety and security, whether it's seatbelts or helmets or umbrellas. They're all highly effective. None is absolute in their protection, and all of them require additional measures to ensure safety, particularly when conditions worsen. That's what's happening here with respect to masks. All that being said, vaccines remain essential to keeping us safe and slowing the spread of the virus. The best way to move beyond masking is for everyone who's eligible to get vaccinated. So with that, I'd like to turn things over to Commissioner Lambrew.
Thank you, Director Shah. I am happy to announce today that the Maine Department of Health and Human Services, in partnership with the Department of Education, is launching a comprehensive plan to support vaccination of school staff and students against COVID-19. This plan advances Maine's nation-leading vaccination rate and complements the Uscdc's new recommendation on universal masking in schools, which will help students and staff safely gather for in-person learning this fall. The Maine School COVID-19 vaccination plan consists of 3 parts. First, we'll be supporting schools in launching free vaccine clinics. Maine CDC will connect interested schools with Maine's hospitals, doctors, and public health nurses, among others, using an online survey and application. School-based clinics will provide convenient, accessible options for school community members. Second, we'll be working with schools on COVID-19 vaccine education. This includes distributing letters to school administrators and parents and guardians, as well as the school community, to educate them about what is the vaccine, how does it work, and what are the nuts and bolts of getting a shot. This information will be translated into multiple languages. We'll be holding webinars. We're also going to be launching a youth-oriented education campaign via social media. And third, we'll be collecting and posting school vaccination rates. Starting in September, Maine Department of Health and Human Services will begin collecting school staff vaccination rates. This will be collected monthly and posted the same way we've done for hospitals and nursing facilities. This will be yet another tool for schools to be able to use to figure out how to target their efforts. We'll also begin posting vaccination rate of youth underage or age 19 and younger by school administrative unit every 2 weeks beginning in August. Connecting this information on vaccination directly with school communities can help guide efforts on where to bring the vaccine and where to educate people when vaccine rates are low. Keeping children safe and healthy is critical to their ability to learn, grow, and thrive. By supporting schools and offering vaccination clinics, helping communities understand the benefits of these safe and effective vaccines, and equipping school leaders with information, they will be able to make the best decisions for their communities, and we can limit the spread of COVID-19 in schools. So with that, Director Shah, I'll turn it back over to you for questions.
Great. Thank you, Commissioner. We're going to turn to our colleagues in the media. It's been a minute. It's good to be able to check in with everyone. So let's start with Patrick Whittle from the AP.
Thank you very much, and thank you for doing this today. I would love to know what some of the factors are that are driving cases in these 2 counties and how close the other 14 are to potentially joining them.
Sure. Thanks, Patrick. The factors that are driving cases in those 2 counties are not unique or dissimilar from other counties. That is to say, individuals who are not yet vaccinated, as well as those who are coming into contact for long duration or in high density areas. That is to say, folks who aren't vaccinated getting together. It just so happens that because of the way the designation for these counties is tabulated, these two counties in particular are where we are right now. Now, there's a couple of notes I want to make about that, Patrick. Maine, benefits in many ways from being a small-ish state, particularly in terms of our population. But sometimes what that can mean is that small fluctuations in the number of people who are sick with COVID-19 or the number of positive tests we get can make pretty big shifts when it comes to how these designations are made. It's kind of the law of small numbers, if you will. We're keeping a really close eye on that because we also want to make sure that these color designations, which come from the federal CDC, not Maine CDC, we want to make sure that those color designations actually match the ground truth of what's going on in those counties. We're keeping an eye on that. It's something that we've had experience with, Commissioner Lambrew and I, from thinking about schools and school county designations. We're going to be doing the same thing here. But Patrick, to go back to your question, what's driving transmission is unvaccinated individuals who are getting together and having contact. What's going on today, though, is the concern that vaccinated individuals could inadvertently be transmitting the virus to others who are not yet vaccinated or not fully vaccinated, driven mainly by the Delta variant, which seems to generate more of these escape cases. That's really what's going on here today and why this masking, and that's the underlying rationale for these masking recommendations. These are recommendations, not requirements, but that's why we are where we are today.
And the likelihood of the other 14, I guess I would love to know how close the other 14 are. Yep.
So that information is also on the USCDC's website. But to answer your question, we've taken a look at that. Interestingly, Patrick, York and Piscataquis are above the thresholds for substantial and high. Thankfully, not so much higher than them. So we hope that there's a time when they can come down. There are two counties that are below the thresholds, but if the current trajectory were to hold, their counties we're watching, those are Knox and Waldo. I don't mean to suggest for a second that they will flip into that orange category. I don't mean to suggest that at all, but those are the two that are further away.
Okay, thank you so much.
Thanks, Patrick. Let me go to Amy Brown next.
Thank you, Dr. Shah. Commissioner Lambrew. Are masks as effective against the Delta variant as they were against the previous variants?
Yes, Amy. Bottom line there is yes. The way that masks work is by blocking these small air droplets or water droplets, that the virus travels through, these so-called aerosols or droplets. And the masks block that. They block you from exhaling it or also inhaling it. And that's the fundamental mechanism of action. And that doesn't really change whether you are dealing with the Alpha variant or the Delta variant or any other Greek letter that we might stumble upon. But here's what's different. One of the things that we've seen with the Delta variant is that it can rapidly multiply. And so someone might have more of the virus in their respiratory passages. And if they were to sneeze, they theoretically could transmit more of the virus. We have not seen any evidence of that yet, but I know that it's something that some scientists at different universities are looking into. But as of right now, according to all the scientists out there, as well as the US CDC, masks work just as well for the Delta variant as they did for other strains.
And how about the 6-foot distancing? I've heard that 6 feet is possibly not far enough with this, and it used to be a 15-minute exposure, close contact exposure with someone within that 6-foot radius was considered a close contact. Is that any of that being redefined?
No, the US CDC, which is really the entity that, in our more recent approach to COVID-19 policy, we really look to the US CDC because they have become much more active and engaged in thinking about these things and issuing recommendations. They have not updated their recommendations for either the distancing or the duration, as you've noted. There's been some discussion about it, but as of this time, no update to that.
Okay. And just one last thing. Have there been any other, or are there any other newer variants on the horizon that are as concerning or more concerning than the Delta variant?
There is a new variant that's on the horizon, Amy. It's called the Lambda variant, but it is not yet known whether it is more concerning, as concerning, or less concerning than the other variants that are out there. There are actually a number of different variants, whether they are some are called variants of concern, some are called variants of interest. They now have a succession of Greek letters by them. But the one that some folks are keeping an eye on is the Lambda variant, but it's not yet known what the characteristics and profile of that variant will be.
Okay, thank you.
Thanks, Amy. Let me go to Brian Sullivan next.
Thank you, Dr. Shah. I wonder, you've been saying for a while now that getting vaccinated is the best protection, and I think a lot of people have heard you, but obviously there's a lot of people who have not and have chosen to not get the vaccine at this point after it being readily available. So what is the best protection for people that are vaccinated and want to keep themselves as safe as possible?
Thanks, Brian. I want to reassure folks who have been fully vaccinated. Folks who have been fully vaccinated, even in the face of the Delta variant, still enjoy remarkable protection against severe illness, hospitalization, and death. That fact, that fundamental, important fact around the benefits of vaccination has not changed significantly. Even today's news or yesterday's recommendation around why those folks should wear masks is based on rare but important possibilities that fully vaccinated people might inadvertently infect somebody who can't yet be vaccinated. But that fully vaccinated person themselves still enjoys a very high degree of protection. If I were, if I were talking to my mom about this just last night, and she asked me a variation of that same question, and I told her, Mom, thankfully you are fully vaccinated. You do not need to worry. But you do need to start going back to some of the steps that you took before, like wearing a mask, so that you can do your part to keep other people safe.
And I have a question about boosters. I've asked you about them a couple of times, and so just bear with me. What if I didn't want to wait and I just wanted a booster? Would that be helpful or harmful? Also, what if I had a Johnson & Johnson shot out of the gate and I wanted to ensure the efficacy of that frightened me, or I was worried about it? I wanted something different. Can you just explain to me how that might play out?
Yep. Here's what I would say to put you or someone with that question to put their mind at ease. Even just a week ago, last Thursday, I had the privilege of participating and listening in on a meeting of the US CDC's Advisory Committee on Immunizations. That committee is composed of experts, world-leading experts in vaccines and infectious disease. And I had the privilege of listening in on their discussion. And both of these exact questions were analyzed, Brian, and with the latest available data. And the consensus of that group was twofold. The first is that for folks who have been fully vaccinated, again, even in the face of the Delta variant, the vaccines that they've got on board remain quite effective, again, even in the face of the Delta variant. So based on where we are right now, for most people, there isn't a strong recommendation on a booster. Similarly, for folks who have thought about the mix and match approach, you got Johnson & Johnson early, but maybe you feel like you need one of the mRNA vaccines. This expert committee looked at the data and discussed those data. There too, even the Johnson & Johnson vaccine, which folks have expressed concern about, still shows robust effectiveness, even against the Delta variant. Now, there are some concerns out there and plans that are being made to think more about people who are immune compromised and what they may need. And of course, as we talked about with Amy, we're keeping our eye on things on the horizon. But at this time, the US CDC and the US FDA are not recommending boosters for individuals who are otherwise healthy, who have gotten whatever vaccine they got so far, because of the continued effectiveness of all three of these vaccines against even the Delta variant.
Thank you.
Thanks, Brian. Let me go to Blair at WGME next.
Hi, good afternoon. I have a couple of questions just pertaining to schools. Will simply recommending that all K through 12 students, teachers, staff wear face coverings, will that make a difference? And what if the majority of people choose not to wear them?
Sure. I think I'll begin and then Director Shah can jump on in. So we have been working in partnership with schools over the past year to first protect them against COVID-19 when there was no vaccination, and then to layer on these additional mitigations. We're very excited by this partnership. So, for example, we launched a pool testing program earlier in the spring and have had significant interest in that. So far, we have about 166 schools in Maine that have signed up for pool testing, with a total of 54,184 school students and staff potentially participating in pool testing. That's weekly testing to assess whether or not somebody in a classroom may be positive for COVID-19. Then we can do a second test, identify that person, isolate them to keep schools safe. We continue to work on vaccines because, as Director Shah said, the number one way to protect people in schools is to get as many people in schools vaccinated. As we know, we currently do have eligibility for vaccine for kids over the age of 12 and older. School staff are also eligible for vaccines. So we will be posting the rates for both students and staff on a regular basis so we can begin to target resources, target energy, target effort and education to encourage all those people in those schools to be vaccinated. And third, with the new US CDC recommendation of having people in schools wear masks irrespective of vaccination status, there'll be that extra layer of protection. We have seen our schools in Maine do a fabulous job of protecting the staff and students there. The rate of new cases in schools all during last year's school years was lower than the statewide rate. And we expect that will be even better going into this fall with these extra new tools that schools have at their disposal to make sure that 5 days a week in-person learning can happen this year with some safety.
You know, Blair, on top of that, to build on what Commissioner Lambrew just noted, these are recommendations, and there is the possibility that some schools may opt to go in a different direction. But what we've seen consistently over the last school year is that students, staff, teachers, and parents have done really hard things to keep Maine schools among the safest out there. Putting a mask on is another thing to help with that belt and suspenders approach to keep schools safe and in person this year. Given the track record that Maine educators and parents have had, we think that they'll keep doing the right thing.
And just lastly here, some superintendents are saying that there's confusion with the language between recommendation and requirement. And some wish that there was a mandate so that would clear up any sort of gray area. I mean, what do you have to say to that?
Commissioner, I can start if you wish. Yep. I'm happy to clear that up. These are recommendations. Putting them into place within each superintendent's district, that's the purview of the school, the district, the school board, as part of our move toward honoring local control. These are recommendations. Implementing them occurs at the local level.
Okay, thank you.
Thanks, Blair. And by the by, Blair, not just as to schools are these recommendations, even as to the former piece as well for individuals in York and Piscataquis. There are recommendations there as well.
Thank you.
Let me go over to Dustin next.
Hi. My first question may seem like an obvious one, but what are indoor public settings? This is a refresher. Are these just grocery stores, restaurants, bars, barbershops, every business?
Dustin, they are the ones that you mentioned. Generally speaking, and I'm not, the guidance speaks for itself. I don't think in the guidance that the US CDC defined the term public setting. And so I think as we've been thinking about it, it's what we would all commonly understand to be a public space. That is to say, a spot where a member of the general public could be invited into or access freely. That's not I don't intend for that to be the binding legal definition, but that's just as a layperson, when I think of a public setting, I think of something along those lines.
Now, Are there any indicators of where the cases in York and Piscataquis County are coming from? And what I mean by that is any of this driven by out-of-state visitors? Is this Maine residents? Is it both?
At this time, Dustin, I can go back to our zip code map and refresh. It's been a bit since I've taken a look at it. It's been a couple of days, but no, we don't have indications that these are cases that are being driven by out-of-staters. Much of the transmission that we have continued to see is among pockets of unvaccinated Mainers.
And then lastly, is there any discussion of a vaccine requirement for state employees similar to other ones that we've heard from government entities around the country?
Yeah, maybe I'll try the answer here. Director Shah, you can add as needed. So just to clarify, when we've looked at what states like California have done, it is a actual choice that state workers have a choice of either being vaccinated or participating in regular testing to make sure that workplaces are safe. I think here in the state of Maine, we do have a rule that says that if you are either not vaccinated or don't report to the state that you're fully vaccinated, then you must wear a face covering in our office buildings as an employer. We have that rule to keep our workplaces safe. We will continue, or we will do what we just discussed about different settings, is also recommend in those areas of the state where the US CDC categorizes them at either a moderate or substantial or high risk of community transmission, recommend that everybody in those public settings wears a face covering. But we do believe that so far we are amongst the top states in our vaccination rate. We feel like we've been making progress, continual progress. We continue to see our numbers go up. We will continue to look at what additional tools we might deploy to increase vaccination rates even further, especially as we approach the fall. But we remain confident that Maine people do the right thing when given information and given options and given the access to these free and effective COVID-19 vaccines. We expect that our numbers will continue to climb.
Thanks.
Thanks, Dustin. Let me go to Megan at WMTW next.
Thanks for taking my question. It's similar to Blair's in that it's kind of about voluntary guidance versus a mandate. In your experience, does voluntary guidance yield enough compliance to actually, in your opinion, make a difference in slowing transmission as we've now seen it rise? I guess meaning, also like what is the threshold to evolve something from a recommendation into a mandate, or is there a threshold?
Yeah, I'll start, Commissioner, if you want. And, I guess there, Megan, again, throughout the pandemic, much of the way that we have approached thinking about the pandemic in partnership with Maine people has relied on that voluntary compliance. You call it voluntary compliance. I think a lot of people call it trust. And throughout, Maine people have made choices that indicate that they care about one another, they care about their neighbors, they care about their community. Whether it's, if you go back even to the earliest days around staying indoors, physical distancing, I think this is another example where we expect that there will be people, particularly in this case, Megan, these are folks who have already been vaccinated, whom we are now asking to throw a mask on. Now, some of those folks are going to say, look, I got vaccinated so that I didn't have to wear a mask. I get that. But a lot of folks are going to say, I got vaccinated because I care about vulnerable people in my community. And if my way of keeping those people safe is by throwing a mask on, I'm going to do that. And I'm hoping we get more of that latter. We've shown throughout the pandemic that Maine people will make the right choice. I don't have any reason to think that that's changed here.
And I'll just add that there is a major difference between now and when we took actions to ensure social distancing, to have people wear masks in different settings, and that is the vaccination. It's a different rule than it was a year ago. We do have a way to combat COVID-19 that we didn't have a year ago when we did have to go to those other tools to try to prevent the spread of a disease. We can now, with that shot, really go the distance. And so we are optimistic that coupling our ongoing intense vaccination effort with these extra layers of public health mitigation will prevent us from having to go back to where we were earlier in the pandemic.
Thank you.
Thanks, Megan. Over to Emily at the Sun Journal.
Hi, Dr. Shah. All of my questions have been answered. Thank you.
Sure, thanks, Emily. Jessica, over at the BDN.
Thank you, Dr. Shah. I wanted to start with a question about schools. And I'm just trying to understand kind of from a how Maine law works perspective. Does the state of Maine have the power to ask schools to require masks at this point? And do schools have the power to require that of their students, or is it a recommendation at every level?
So I'll begin by saying neither of us are in the Office of the Attorney General, who's best positioned to answer the question about Maine state law. I would say that previously, when we were working in different settings with rules regarding masking and distancing, it was during a state of civil emergency. That state thankfully has ended. And at this point, we think that school districts should look at their own policies, their own protocols, and see what tools they have at their disposal to make the decisions about whether they do implement the US CDC recommendations as just that, a recommendation or requirement.
All right. And then with respect to the differences between counties, at the beginning of the pandemic, it was discussed that the governor was making a lot of statewide recommendations because people travel between counties in Maine very often. Kind of what is different about the situation now compared to then?
Well, one thing, I
was going to make a slight correction. We actually did at the beginning of the pandemic have different county level policies about community transmission. We shifted to statewide during the summer when we really did have more of a statewide approach to our policy. And then again, going back to the fall when we were doing the health advisories for schools and hybrid learning, that was also local. So I do think we had a mix of statewide and local policy. I do think it's important to remind folks that this year has been different than last year in another respect, which is the US CDC director has been more actively involved in developing guidance, working with states, issuing different recommendations. So we made a choice here in Maine to prevent there being confusion over a Maine state set of recommendations and a US CDC set of recommendations, as well as recommendations that vary state by state, to look at what US CDC puts out like we did yesterday. And when we, in our review, find that it feels grounded, support those recommendations. We don't always support the US CDC recommendations. We will always look. That's our jobs. But in this instance, when we looked at the preliminary data that they posed to Director Shah and other experts, we felt as though we would adopt and recommend that Maine people follow the new recommendations regarding face coverings.
I completely concur. And on top of that, Jessica, one other difference between now and before, the Commissioner noted this previously, is vaccination rates. Nationwide, county by county, vaccination rates explain roughly 80% of the variation in case rates from county to county to county. That's from data from the US CDC. And that's the case here. That's one reason why these county level designations, as it relates to masking recommendations for vaccinated folks, it's one reason they make sense. Now, to be sure, these are not to be read in isolation. If you are a resident of Cumberland County or Saginaw County, but you're going down to York County for an indoor public event, you should mask up while you're there. So it's not as if these counties are on an island, but given all that we know, there are differences in risk, and that's one reason why the US CDC's recommendations are structured the way they are.
Sorry, and just one quick follow-up to that. How often are you anticipating that these guidelines will be updated? It looks like the US CDC puts out these reports every week. Are you expecting there to be kind of new county designations once a week or more or less often than that?
My understanding is that the US CDC intends to keep updating their county map once a week.
Thank you.
Thanks, Jessica. Let me go to Patty White at Maine Public.
Thanks, Dr. Shah and Commissioner Lambrew. Dr. Shah, you mentioned at the beginning that we're seeing the Delta variant in about 50% of cases or close to that. I mean, do you think that is really what we're seeing, given that the national average is 80%, or are we probably higher?
No, so the national average is 80%. That, of course, reflects states in the Southeast and in the Sun Belt that are even higher than that. The New England average, Patty, is about 60+%, 60 and change. And so we're probably closer to the 60+ mark than the 47%. All of this, of course, is based on sampling. We take a subset of the positive results that we have and do the full sequencing on that. It's at least 47%. Could the top end be 60? It's certainly using a lot of imprecise words. 47% is at least what it is. It is almost certainly higher than that, though. The New England average is in the 60s. I'll get you the exact number, Patty, from a recent report from the CDC. Could it be into the 70s and 80s? That's a possibility, but that would put us out of line with New England. It's more likely to be the case that we're in the 60% band.
Okay, thanks. And then this is related to the question that Jessica just had, but can you just tell us a little bit more about, even though you adopted what the US CDC is recommending, why not just ask people to wear masks statewide? Wouldn't that be simpler? And especially considering that cases are going up, we're not really seeing indications that things are getting better. So why not try to get ahead of things and just say statewide, everyone should wear a mask?
Yeah, and so, Patty, to make sure I answer your question properly, you're not asking why not make this a mandate. You're just saying you're asking why not just make the recommendation a statewide one?
Yes.
Yep. I think this is the balance, at least in my mind. And Commissioner, please weigh in after I start. There is a balance here because the balance is giving people advice based on the risk in their area and not making them feel that the vaccine they got was for naught. Or, for example, continuing to incentivize folks to go get vaccinated so that they need not wear a mask. By my lights, Patty, going with the county approach that the US CDC has recommended gives people the right level of risk calculus so that they can ultimately make this decision where they are. I don't want to necessarily tell people that the risk is higher, that they may generate a breakthrough case if it's not really there in their community. We know that right now, at least, York and Piscataquis are relatively higher. Thankfully, Maine relative to, say, the Southeast is a lot lower. But if we were to go in that direction, one, that would be contrary to what the US CDC has recommended. They are recommending this county by county approach. And secondly, it would be for many people to suggest that there's a risk there that doesn't actually exist. It could exist, and if it does, we'll be ready. Sorry, Commissioner.
No, I was just going to have one recommendation, statewide, simple, that I think we all would agree with, which is get a vaccine. We know that the way out of this pandemic is vaccination. The more people that are vaccinated, the fewer people will be carrying these heavy viral loads that Director Shah talked about with the Delta variant. The safer people will be, even if they are still unvaccinated. But we do think that we now have something that's extraordinary, a COVID-19 vaccine that is really incredibly effective compared to other different types of vaccines. It is very safe. We have now real world experience coupled with the studies that went into its approvals to demonstrate that it's safe. And we can get beyond this complicated set of guidance that we know people do sometimes glaze over when they hear, when am I supposed to wear a mask? What am I supposed to do in this setting? The simple solution is get a vaccine.
Patty, just to build on that one more step, the vaccines work. And I don't want today's discussion to be read as the vaccines aren't working. For some people who have regular interactions with folks who may be immune compromised or have young kids, we want them to take an extra step of safety. But the nucleus of the matter here is that the vaccines work. And if you're fully vaccinated, wearing a mask where there's not a lot of virus circulating around you, or you're not in regular contact with vulnerable folks, isn't something that's necessary. That's how good they are.
Thank you.
Let me go to Eric Russell next.
Thank you, Dr. Shah and Commissioner Lambrew. You know, when you go this late in the game, a lot of people take your questions, so I got to scramble, but I've got some. I think I have one for each of you. The first question for you, Dr. Shah, has to do with where we're at in transmission and the threat of exponential growth. Is the threat of exponential growth much smaller now given our vaccination rate, or does the possibility of breakthrough cases make that the same level of risk, I guess?
Eric, I'm gonna do what I've always tried to avoid doing, which is by giving you a yes and no answer. Yes, I like the way you phrased it. The risk of exponential growth is lower now than it was before. You know, we're at a point now where 72% of Mainers are fully vaccinated. 77% have gotten at least one dose. You know, we're ahead of most countries. We're ahead of Israel. We're ahead of a lot of highly vaccinated places. That means the virus has a lot less room to run and thus generate exponential growth. That's the yes, I agree part of my answer. The question mark or asterisk is that there's still that possibility that another variant could emerge, whether it's Lambda or Mu or whatever comes next, that could be resistant to the vaccines. Based on everything we've seen to date, that's less likely, but it's a possibility. And for those who are concerned when they hear that, the best thing that you can do is to do what the commissioner just noted, go out and get vaccinated, talk to a friend of yours who's not been vaccinated, share your experience with them, and try to get them on board too. I mean, to be cliche, the better we do now, the better we'll do later.
That leads to my next question, which is for Commissioner Lambrew. I know that a month or so ago, there were some discussions about other strategies the state could adopt to make vaccines more enticing for those who, for whatever reason, have not rolled up their sleeves. Do you have any updates to give us on that about, whether it's incentives, whether it's educational efforts? Have you exhausted all of your options in terms of reaching out to people who have yet to get vaccinated?
I'll say that while there are some of us who are exhausted, we will never say we've exhausted all of our efforts. We continue to look at all different options. Speaking 1 minute on incentives, we have been scouring the experience of other states to see, is there something that we haven't tried that might work? We'll continue to do that. So we don't have anything to announce right this second. We are definitely, as I announced earlier today, going to be focusing on school-based clinics. As a reminder, we do have variation in vaccine rates by age. We know that younger people are less likely to be vaccinated, partly because certainly people ages 12 to 15 only became eligible for vaccination later in the game than older people. So that school-based strategy is certainly one that we're going to be focused on. We also are working with our aging community, our disability community, to go into those pockets of people to find out, are there people who might have struggled to get a vaccine? How do we move vaccine to those folks? We continue to ensure that we are reaching people of color, ethnic minorities, different pockets of people who may have concerns about the vaccine, may have had disparities related to the vaccine. So we will continue this all of the above effort to try to get people vaccinated. And that includes strategies going into the fall that we're going to be learning from other states. We're watching carefully what's going on with this vaccine or test experiment that we're seeing in some states. We're looking at how the Veterans Administration experience of beginning to require its workers to get vaccinated goes. So we will never say we've exhausted all efforts to get people in Maine vaccinated until 100% of our population is vaccinated.
Exactly.
Thank you both.
Yep, thanks, Eric. And let me go next to Chris Costa.
Hi, Dr. Shah and Commissioner Lambrew. The first question for you, I'm not. Pardon me if I've missed this in the past. Right now, the Maine Department of Education requires several immunizations like DTaP, polio, chickenpox, MMR. Has there been any discussion on requiring a COVID-19 vaccine for public school entry for students?
Certainly, Chris. We discuss all different ideas and options. We've had that discussion, and it's timely insofar as we're implementing a prior piece of legislation to remove religious and philosophical exemptions for some of the vaccines that you noted. We're not there yet for COVID. We're looking toward things like the authorization for younger groups, as well as the full FDA approval, which we anticipate or hope will start happening in the later half of the year. We're discussing it, but those are some of the administrative steps at the federal level that we're looking toward.
Okay. And then I know that we've covered this in the past, and Dr. Shah, you addressed it, a little earlier in a couple of the responses that you gave. Early evidence seemed to suggest that the vaccines were very good at preventing the transmission of the virus, somebody who was fully vaccinated. Can you help explain why it sounds like this may have changed a little bit? Is it due to the Delta variant, or are we learning more about the vaccines and their effectiveness on that front?
Thank you, Chris. That's a great question. The answer is the former. It is because of the Delta variant. Indeed, just over the weekend, I had a conversation with some of the senior infectious disease experts at the US CDC to go over some of the data that they're seeing. And what they noted was that if you compare Delta and its behavior with, say, an earlier variant, the Alpha variant, when someone who was vaccinated got exposed to the Alpha variant, it barely registered. It was as if the virus never even got into their body. But with the Delta variant, the virus seems in some people, not all people, but on occasion, to be able to get into their body and reproduce. Now, whether it ultimately makes them sick or not, that's a good question. And the extent to which that virus reproducing in their body could get transmitted to others, well, that's the risk that we're talking about today. Hence the recommendation to wear masks, so you don't accidentally infect somebody who can't be vaccinated. But this is a function not of the vaccines wearing off or getting worse, but much more because of the virus itself being formidable and wily and just being better able to reproduce. That's really what's going on here. Does that answer your question?
I think so. Am I understanding you correctly that the Delta variant, because it carries a heavier viral load, is able to be transmitted more easily than another variant, even by somebody who's fully vaccinated, or did I misunderstand?
You nailed it, Chris, and you put it exactly right, and in the right technical terms. I didn't want to get all technical. I'll do that with Keith Carson. You're right. One of the features that explains why the Delta variant is able to spread so much quickly and in numbers that we've seen unfold in the Southeast is because it reproduces in the body so much more quickly. And that's one reason why, even with vaccinated folks, even though they might not land in the hospital or they may not die, they would have a lot of virus in them, in some people. And thus the concern that they might inadvertently spread it to somebody, even though they're not super sick, they might inadvertently spread it to somebody. And that's why, that's the dot that connects the recommendation today for masking with the Delta variant. It's because of that rapid expansion.
Okay, I just have one last quick question. Do you have the number of breakthrough cases in the state right now? Oh no, go ahead.
Yep, it is 596 breakthrough cases right now in the state of Maine.
And so I guess my question about that is that the symptoms that somebody who is considered a breakthrough case can experience can vary. Is that right? And can you describe for people generally, or what percentage of people are experiencing mild symptoms, moderate symptoms, or potentially severe symptoms? Because we know the vaccines are supposed to be 100% effective against those severe hospitalizing type symptoms, right?
Indeed, yes, Chris. The symptoms that someone can experience if they are having a breakthrough case are the same ones that they could experience if they were unvaccinated. But one of the things that we've seen in those, call them 600 breakthrough cases in Maine, is that the majority do not have any symptoms. We found out about them because they were participating in a regularly scheduled testing program. For example, maybe they're a healthcare worker. The bulk of them, though, if I recall correctly, the number was about 61%, did not have any symptoms whatsoever.
Thank you both.
Thanks a lot, Chris. I want to, excuse me. Sorry about that, everyone. I just want to take a second to thank everybody. I know it's been a little while, so I'm thankful for our colleagues in the media for hopping on this afternoon. Just to reiterate where we are today, nationwide as well as in Maine, we're seeing an increase in the number of cases attributable to the Delta variant. As we just talked about, that variant carries a greater possibility of generating breakthrough cases, as well as accidentally infecting somebody with the virus who might not yet be able to be fully vaccinated. That's why the US CDC has altered its recommendations, which we agree with, that for folks who live in areas of the state where there's a lot of virus circulating, they too should put on a mask if they're going to be indoors around members of the public, even if they're fully vaccinated. We think that this is part of the pathway to getting us out of the pandemic to reduce the number of cases overall. I'd like to take a moment to thank everybody for their time. Commissioner, any final thoughts just to make sure I didn't miss anything else? Oh. Sorry about that.
There you go. Just a quick reminder that we continue to have a list of sites where you can get a vaccine for free when you search maine.gov vaccination sites. You can also call 1-888-445-4111. Our major pharmacies, our major supermarkets in Maine continue to offer the COVID vaccine, oftentimes without an appointment. And we urge everybody to do the most important thing that they can do to protect themselves against COVID-19, which is get a shot. Thank you.
Thank you all so much. Have a great afternoon. As always, be kind and take care of one another. We'll hopefully talk again soon.